Hello and welcome to today's training. My name is Tessa Donahue-Niver and I am the Director of Performance Improvement here at the Brownville Memorial Hospital. Today we're going to go over a training that's focused on health literacy. So this training was put together in response to some of the results we've been getting from the Press Ganey Satisfaction Survey that our patients and their families take after receiving care here in our hospital. The results have consistently shown that there are issues with the hospital's health literacy efforts. Patients and families are consistently rating the hospital staff poorly on providing information that made it easy to understand and improve their health. And many survey comments have stated that patients found the health information that they were given confusing and they didn't know how to act on that information. So as a health and hospital system, we are working to improve our health literacy education for all of our staff. This is in an effort to give our patients and their families a better experience and more clarity on their health status and their treatment. Communication and health literacy are important to the success, the efficiency, and the effectiveness of our organization in the long term. And as an organization, our staff needs to be trained and aware of what health literacy is and how to execute on it. There are two key areas of concern that we're focusing on today. That is the communication that we have with patients and families and how clear that is. We're also working to create an environment where patients are able to ask questions and feel comfortable doing so. So first we want to touch on what health literacy is. It's something that we likely are all pretty familiar with, but I just wanted to clarify it a little bit further. Health literacy is the degree to which an individual is able to maintain or obtain, process, and understand basic health information and the services that are needed for them to make an appropriate and sound health decision. It is a shared responsibility between the patient and the provider, and both are required to be able to communicate in a way that the other person can understand. So it falls as a responsibility on both sides. Health literacy is dependent on several factors, including education, language, culture, and terminology used by healthcare providers and systems. So not only just the provider, but also our entire facility and our staff. So it could be, the elevator signage trying to direct people to a certain unit, or it could be the information about a health topic in the office. So it's not just the provider's language; it's also just us as a facility overall and as a hospital system. So health literacy impacts people's ability to navigate the healthcare system. That could be filling out paperwork or locating a provider. Their ability to share personal health information like health history, health concerns, or allergies with their providers. It also impacts their ability to engage in self-care and chronic disease management. And then also their understanding of medical terminology and mathematical concepts like the probability and risk that could be involved with a certain treatment, or maybe the amount or timing of a medication. So over the next few months, we're going to be continuing to learn more about health literacy. We're going to be doing some training and workshops in small groups to ensure that all of our staff is fully trained on what health literacy is, and then also some of the techniques. So how is our nation addressing health literacy? So kind of just taking this out to a macro level to kind of look at how overall as a nation we're addressing this issue. So one of the first initiatives that came to mind was Healthy People 2020, which is a huge decade-long initiative that the entire United States is aimed at kind of improving several health and wellness targets. So improving access to health care and then also improving health literacy efforts. So that's one that's really important to us. Also the Affordable Care Act, which is going to be impacting a lot of people that we see here in our hospital. Several provisions of the law indirectly targeted health literacy. The coverage expansion obviously allowed a lot more people to access care. It focused on equity, workforce training, which is what we're doing here today to ensure that our staff is fully trained on health literacy. And then also making patient information available at appropriate reading levels, which is extremely important to health literacy efforts. There's also two programs that the U.S. Department of Health and Human Services has put together that are really effective. So the National Action Plan to Improve Health Literacy, which helps to engage stakeholders from a variety of sectors in an effort to improve health literacy. So it's not just the health field. And there's 7 goals in this plan, and then there are a variety of resources available to the public to help organizations improve how they utilize and practice health literacy. There's also the AHRQ Health Literacy Universal Precautions Toolkit, which is aimed at helping primary care practices specifically enhance and improve their support for health literacy across all levels. So that's something that we'll be utilizing system-wide with our primary care physicians. So the first key area of concern that we're focusing on is communicating clearly with our patients. So why is this important? Communication is the foundation to literacy and health literacy. It is health information that needs to be clearly given to our patients, and it's also the ability to understand that information properly. That's really important to, kind of the foundation of health literacy. Staff need to be capable of utilizing easy-to-use communication strategies to help patients avoid further illness, lower costs, and also reach goals of quality care and good health outcomes. So it really is a huge responsibility of ours for patients when it comes to not only just helping them stay healthy, but avoid getting healthy again and walking back through the doors and being readmitted. So miscommunication and misunderstanding are at the basis of many costly medical errors, hospital readmissions, and compromised health outcomes. So that is something that we're really aimed at improving here on a day-to-day. So this just kind of helps us hone in on that a little bit farther. So the research shows that additional cost of limited health literacy ranges from 3 to 5% of the total healthcare costs per year. And for patients with limited health literacy, the additional cost when compared to those who have adequate health literacy skills, it goes from $143 to $7,798 per year per person, which is an extremely large jump from one person to the next. And you can see how dramatic the impact is for someone who has low health literacy on their pocketbook and on their health. So that's something that we really need to consider. There are several communication principles and methods that we want to use to help us communicate more clearly with our patients and their families. Our providers should be able to give a clear understanding of what patients need to do, why it needs to be done, and the exact details of how to do it. So not just the knowledge, but also the skills that they need to practice when they go home. Providers should confirm that patients understand what is being discussed by addressing questions and utilizing methods like the teach-back technique, which is a method that can allow you to assess a patient's recall and comprehension of important topics that were just discussed. So if you're discussing how to take a medication or how to build a healthy meal, you can use the teach-back method to see if the patient can recall what was just reviewed and if they are confident enough in what they recall to be able to go home and do that and take action. So we need to also acknowledge cultural and linguistic differences when interacting with patients that come from different backgrounds than our own. That could be someone who's a different race or ethnicity, someone who speaks a different language, someone who comes from a different region of the United States and isn't used to this area. There are a variety of different cultural and linguistic things that come into play when interacting and communicating. And because we serve such a variety of different people here at our hospital, this is extremely important for us to focus on. Providers should be trained, equipped, and ready to use interpreters when interacting with patients, and that's something that we've always had available and will continue to have available, but we kind of want to boost the use of that and feel more confident in pulling that tool in. So best practices, we want to avoid using jargon and complicated medical terminology without defining it. For example, the phrase, "your blood pressure results show that you have hypertension," could be confusing to a patient. Many people don't know what the word hypertension means, so instead we can use phrases like, "your blood pressure is higher than we would like it to be. This is called hypertension," which means, and then go on further to explain what that actually means physiologically. This helps explain the term so that the patient isn't confused about the condition or the state of their health. There is an ethical dilemma involved with the amount of information that we share with our patients. We want to find a balance between sharing too much but not sharing enough because we don't want to overwhelm patients. But we also want to help them get the information that's necessary for them to be safe and also confident when they leave our office. So we want to be able to reinforce what we're discussing with visual aids and handouts, especially for those topics that are new for the patients and something that might be really complicated, like a diagnosis of diabetes. We want to be really sensitive to communication barriers like language differences and hearing loss. We need to provide interpretation and translation services to ensure clear communication can occur. This is not only an ethical concern, but a legal concern too, because we're required by law to provide it. So our second key area of concern is encouraging patients to ask questions. So why is this important? Patients that have low health literacy are typically less familiar with medical terminology. This can cause them to ask less questions, and they might hide their misunderstanding out of shame or embarrassment. Oftentimes, healthcare interactions are limited on time, and our providers are pushed to cover a ton in a small period. This can reduce the time and opportunity for patients to ask questions or for providers to confirm the patient's understanding of what was shared or discussed. When patients are involved in the process, their adherence can improve, their satisfaction can improve, and they might be more likely to receive care that is in accordance with their values and their preferences, which is really important to consider and be sensitive to. Patients need to be able to be comfortable enough to describe their symptoms, ask questions, and express their opinions about treatment and care. We must create a space where patients feel comfortable asking and answering questions without fear or judgment. So, that has a lot to do with tone of voice. It has a lot to do with, how we lead into the time where questions can be asked. That's something we really need to be mindful of, and we don't want them to feel like any question or comment is stupid. Providers should invite and insist on questions from their patients, but be mindful of cultural differences and emotions. We want to assure them that it's okay to ask questions because some people might come from a culture where asking questions is frowned upon, so they're not necessarily comfortable with that just yet. We also want to train our staff on techniques like teach-back. We've already discussed this today. It's a huge technique that can be utilized in a variety of areas. It's going to help us communicate more clearly, but it's also going to help us encourage patients to kind of show us what they understand, and if they don't understand something, then they can ask a question afterwards. We also want to utilize open-ended questions to clarify patient understanding and feelings. Both of those things will be practiced today in our small group activity at the end of the training. So best practices. We want to avoid yes/no phrasing when appropriate. For example, do you have any questions? This can close off a patient's response, and it doesn't really motivate them to ask a question in the same way that this further response would. So instead, providers can elicit questions through open-ended phrasing, like, what are your questions? Which really motivates the patient to think about that and say, okay, well, what are my questions? I need to ask something. So if they're feeling a little bit embarrassed by it, they might be more motivated with an open-ended response like that. We also need to avoid not allowing patients the time to ask questions for fear of how long it might take. We have to consider the time and expense that is involved when patients don't understand things or have to call back to clarify. This is an ethical and an efficiency concern because ethically we need to provide our patients with the information that they need to leave our office and take care of themselves and take care of their health. We are required to do that. That's what we're here for. But efficiency-wise, it's also a huge concern because if patients have to call back multiple times to get a further understanding or clarification on things, that's not really efficient. So instead, we want to encourage patients to write their questions down while waiting when they arrive for their appointments and allot a few minutes with each patient for this activity. So we are going to wrap today's training up with a small group activity that's going to focus on role playing. It's going to allow all of you to practice some communication skills from both the patient and the provider perspectives. We're aiming to practice a variety of skills surrounding health literacy, including recognizing health literacy capacity, the teach-back method, open-ended phrasing, lots of skills that we're going to learn. So we are really focusing in on those key areas of concern. We're going to incorporate some miscommunication, some misunderstandings, some short time frames. We're going to allow you guys to work from both perspectives so that we can understand where the barriers exist on both sides. So the materials, we've got worksheets, we've got props to make it more realistic, and then we've also got a checklist or a rubric that we're going to use to kind of see how the skills are being practiced today. So we're going to go through these three scenarios. It's going to be a phone conversation between patient and provider discussing medication changes, then a patient that's recently been diagnosed with type 2 diabetes, and then also a Spanish-speaking patient with an annual physical visit with a provider that's not fluent in Spanish. So we're going to pair out into groups of 3. Each group will work through 2 scenarios from the 3 that we've listed. We're going to assign the role of patient, provider, and observer, and the observer is going to go through that checklist that we've provided to kind of just observe for those techniques being practiced. We're going to give 40 minutes total for those scenarios to be worked through, so each scenario should take about 7 to 10 minutes, and we want you guys to also leave time for feedback and discussion. So we want you guys to consider what's realistic as you work through these scenarios. Consider what it sounds and feels like in a real-world scenario. We also want to take notes and reference the checklist throughout the activity, and then also kind of work through and allow some discussion at the end of the activity. So once we've worked through this, we'll come back together as a group and kind of discuss the lessons learned and the takeaways. If there's any questions that you don't have answered at the end of the training, we'll have time for that. Also feel free to contact me before or after the training or the workshop has ended with any questions or clarifications. All right, let's break up.